Yarema, MD, who's also an acupuncturist, and he has expertise in regenerative medicine, anti-aging medicine, integrative medicine, and has quite an impressive resume. I'm going to let him just give you some insight as to what this man does. It's incredible. He'll be presenting today on building greater scientific predictability of results in stem cell therapy, more effective management of patient expectations, and he'll be addressing complex chronic medical conditions also. Tom?
Well, thank you, Marty, and thank you, Dr. Farstian, for this opportunity to speak. This is my first time with this professional association, and I'm very, very excited to be here among so many of you that are so deeply committed to rejuvenation. It's a great passion of mine, and I'm very much looking forward to meeting each of you individually and learning from you. What's taken me so long to get to this conference are three things. First of all, even though I've worked many places around the world, in the last 2 decades I've been working mostly in the United States in the state of California, which is a very prejudicial location for that which is dear to our hearts, regenerative medicine. Secondly, I don't have a practice that focuses on orthopedics or aesthetics. My practice focuses on chronic complex medical conditions. And it's only been until recently where I've had the availability of stem cells that I didn't have to harvest. So today I'd like to introduce you to a very simple, inexpensive, office-based technique which will have both your prospective patients and your competing colleagues in your community trying to squeeze out of you, why do your stem cells work better than everyone else's? Very interesting question. So for each of us, whether we're doing orthopedics and aesthetics, or we're doing chronic complex medical conditions, whether we're harvesting and expanding in our own, or whether we're using an off-the-shelf product, we each have 3 questions that we have to answer commonly to our patients. The first is, how much is this going to cost? How much benefit can I expect? And will I need to be treated for the rest of my life? Would you guys agree with that?
Yes.
So the challenge for us, and for myself, is in attempting to maximize the benefit, there are certain questions that I ask myself. And particularly if I'm not doing a highly focal, localized injection on a single pathology. The first one is, will the stem cells be addressing the patient's greatest physiologic deficiency? And if so, will that give them the benefit that they're looking for, that they're desiring for? For example, in a patient with severe diabetes and metabolic syndrome who is having a peripheral neuropathy, is my infusion of stem cells going to make them less painful walking, or is it going to be treating their pancreas? Additionally, the FDA Commissioner Scott Gottlieb has stated that although the FDA wants to roll out stem cell therapy to the American citizenry as quickly as possible, he also asserts that he's completely committed to cracking down on practitioners purporting unscrupulous claims, that is, setting false hopes in patients. So underscoring both of these questions is how to scientifically create predictability for the individual in front of us. How to scientifically create predictability in the individual in front of us. Yes, we can wait for the results of clinical trials. The field's moving quickly, and I'm very, very excited and interested in hearing what this association is doing for the IRB. However, you each know, like I know, that in these complex medical conditions, the results come from individuation of therapy. So predictability emerges from a science that's rooted in monitoring, and monitoring which is precise, which is reproducible, and it's specific to the physiologic mechanisms of the agent that we're using. In this case, whether it's stem cells or exosomes or peptides, and it's something that is shared in the greater community. So ideally, this monitoring should be convenient and accessible, low cost, quick, and be able to give us real-time results. This weekend, my poster presentation demonstrates the application of an in-office, real-time, scientifically authenticated monitoring system based on the physiologic model on which we believe stem cells to be working. And it's performed on a device which is readily available, it's approved by the FDA, and it costs less than $100. And it only requires 10 to 15 minutes of time to assess your patient, and you could train a staff member to do it. What will be tough, though, by nature of the data that's collected, is the sum of all your years of education in embryology, developmental anatomy, and neurobiology, which is actually changing very, very quickly because of the international research being done in this particular field. And so that refreshment of that knowledge that you learned many, many years ago, coupled with your sum of clinical experience and acumen, is going to give you the power. For those of you not acquainted with auricular acupuncture, let me give you a short history. Auricular acupuncture has been around for at least 2,000 years. And then it was rediscovered in modern times in 1956 by Dr. Paul Noget of Paris, after he witnessed a lot of patients coming through his practice that had a particular area of cauterization on their antitragus. And then he found out that there was a layperson in Paris who was treating people for sciatica, and she had learned it from her father, who had learned it from a Chinese mandarin who worked in his employment at his laundromat. So Paul Noget postulated a homunculus that somatotropically mapped into the human body, and his theory went to Germany, it went to Japan, then it went back to China during Mao Zedong's post-revolution. And in 1958, China did the first modern clinical trial on over 2,000 patients in the Nanking Army, which established its modern clinical diagnostic and therapeutic efficacy. Between 1984 and 1987, the World Health Organization took notice, acknowledged its value, and then forced the standardization of an international nomenclature so that this science could be shared for the benefit of our entire planet. For any of us who have disimpacted the cerumen from a patient's ear, recall the coughing or the yawning of the patient. This is known as Arnold's reflex, from the German anatomist of the same name. Thakkar in 2008 in the Journal of Otolaryngology published an extreme case study of a young woman who fainted every time she scratched the external auditory canal. Previously in 1979, Engel published in the Archives of Psychiatry and Neurology 8 different vaguely mediated reflexes between the auricle and the organs of the stomach and esophagus, the lungs and the heart, the uterus and genitals, and the meninges. Now, although few people exhibit this extreme sensitivity that Thakkar described in auricular syncope, it really underscores the profundity of the hard wiring of this neuro route. Thank goodness not all of us are as sensitive as his patient in the case study was. But many of us wish that our spouses would be more sensitive in Engel's auricular genital reflex. just come in and blow in my ear, or let me blow in your ear. In 2002, Alemia authenticated by functional MRI the auricular homunculus postulated by Noget in 1956. And if your clinical expertise and acumen includes either traditional Chinese medicine or modern Western neurophysiology of the subcortex, then you can use auricular monitoring not only for somatic mapping, but also for cognitive and effective prediction. Romoli in 2009 demonstrated a 78.6% success rate in identifying symptoms and syndromes relating to both the somatic and to mental disorders using auricular diagnostics. In 2015, Pu Wei Hu of the Chinese Medical University in Taiwan published the most excellent 13-page review article enumerating both the diagnostic and therapeutic mechanisms of auricular acupuncture. Most interesting to me, and I think to everyone in this room, should be that review article discusses the mediators that have been scientifically documented in response to auricular acupuncture, and some of those mediators parallel the adjuncts that we are using in priming stem cell therapy. Interleukins, and in particular, tumor necrosis factor alpha. So in my poster presentations case study of auricular monitoring, I described one of my long-term diabetic patients, narcotic refractory to peripheral neuropathy of multiple etiologies, not just a diabetic peripheral neuropathy, but also a grade 4 spondylolisthesis 5 years after fusion, who also was a plumber with significant lead exposure and on the verge of suicide. And after his stem cell therapy, which was applied through intravenous infusion, acupoint injection, both peripherally and auricular acupoint injection, and also then theoretically assisted with homing through electroacupuncture. Of course, he had magical results, but what was unexpected was 3 days after therapy, he voluntarily withdrew from all narcotics with almost no withdrawal syndrome. The corresponding changes which I can observe in the monitoring of his auricular acupuncture, imagine doing like a functional MRI on the total body of your patient before your priming, after your stem cell therapy, and then 1 month later, and observing the changes. The corresponding changes, specifically the disappearance of electrical reactivity in the anterior pituitary, the hypothalamus, and the pineal acupoints, but not in the lumbar region where we thought most of his pain was originating from. What we can easily learn is that this convenient low-cost monitoring and how we can strategize on future stem cell treatments according to an individual's physiology in chronic complex cases. So if you're interested in the scientific references that I've spoken about, particularly the 2015 review article, you can text my cell phone, just punch in a number 44133, and in the text write the word stem cell, all one word, and I will give you a PDF of the scientific articles for your perusal. And if you'd like to be trained in auricular cartography, there's an international symposium that happens every 2 years. The next one is coming up in June of 2020. If you can't wait that long, I'll be happy to give you information about the training that I host in Santa Cruz, California. And Santa Cruz is a very beautiful spot. It's where the old growth redwood and sequoias meet the Pacific Ocean. And I believe that those trees, those 4,000-year trees, probably have some of the oldest stem cells that we can enjoy. So thank you to the Academy. It's wonderful to be here, and I very much look forward to meeting and learning from each of you.